Is your PCOS getting in the way of you living your most fulfilling and joyful life? Have you exhausted every option Eastern medicine has to offer while risking painful and possibly permanent effects on your reproductive health? Does it feel as though your symptoms have overcome every aspect of your life? You should know that you are not alone. 1 in 5 women in the UK live with this condition. Irregular or absent menstrual periods, acne, unwanted hair growth, weight gain, and infertility are common symptoms of PCOS. In recent years, there has been a significant hype about using traditional Chinese medicine to treat health issues and reduce symptoms. Acupuncture is one of the top alternatives for people seeking natural healing. If you want to learn about a non-invasive and risk-free technique to aid your PCOS in a holistic manner, then you have come to the right place. Keep watching. Before we dive into the treatments, we should learn what is PCOS and what causes it. PCOS stands for Polycystic Ovary Syndrome. This is an endocrine disorder that results in the formation of multiple cysts on the ovaries. However, not every woman with PCOS would develop cysts. At its core, this disorder causes an imbalance of reproductive hormones, creating dysfunctional insulin, cortisol, and testosterone levels. It is more commonly known as an infertility diagnosis, where an abnormal amount of androgens is produced by the ovaries, resulting in menstrual cycle issues. Although a specific cause for PCOS has not been identified, studies have linked its occurrence to lifestyle or environmental factors like a sudden weight gain, stress, inflammation, and a diet high in sugars. If you're wondering if PCOS is treatable, there really is no yes or no answer. Treatments for PCOS depend on a variety of factors such as your age, the severity of your symptoms, and even your own willingness to make some lifestyle changes. This process often involves medications that help diminish symptoms, but the overall condition cannot be completely cured. With traditional Chinese medicine, the main objective is to create the perfect balance in the endocrine system with a holistic approach. But how does acupuncture help? To better illustrate, we will cite several studies on the practice. A study from the American Journal of Endocrinology, Physiology, and Metabolism found that undergoing a series of acupuncture treatments over a duration of 12 weeks could actually reduce the metabolic effects of PCOS. By inserting needles to stimulate certain points of the body, a neurological reflex is produced and transmitted to the organ correlated with that nerve pathway. A study on the effectiveness of acupuncture for treating ovulation disorders in PCOS revealed that although the treatment was not as consistent in improving ovulation rate, it did improve the restoration of regular menstrual periods. Another research tried to summarize and evaluate the evidence from randomized controlled trials using acupuncture to treat PCOS. It focused on ovulation rates, menstrual rates, and related hormones. The evidence did not suffice to prove that acupuncture is likely to improve population rate and squirrel rate. However, it did confirm its significant benefits as a treatment supplement to medication in luteinizing hormone, testosterone, fasting insulin, and pregnancy rates. Despite conflicting findings on the effectiveness of acupuncture for PCOS, the hype behind it prevails. Acupuncture gained traction when there was not enough scientific understanding of human biology. But today, many clinics provide acupuncture treatments using particular herbal medicines, diet, and exercise. Acupuncture is suggested quite often for women who are not ovulating regularly, and sometimes it results in a more balanced menstrual cycle after going through an acupuncture course for 2 to 3 cycles. So, which are the acupuncture points for PCOS? According to the British Medical Journal, the needles used in acupuncture can stimulate nerves that release happy hormones like serotonin and opioids. Following the principles of traditional Chinese medicine, a total of 8 points were selected to address infertility. Bai Hui, GV20, Tian Shu, ST25, Qi Hai, CV6, Gui Lai, ST29, Gei Shu, BL17, Xin Shu, BL15, Shen Shu, BL23, Pang Guangshu, BL28. These points have also been used to treat PCOS infertility through acupuncture. If you feel like you have tried every recipe in the book, you might be due to give acupuncture a chance. Just remember that it seeks a holistic healing process, so with a combination of medication, lifestyle changes, and acupuncture, you would get the most out of your treatment.